Janice Wheeler here, president of The Art of Management. We have been consulting healthcare professionals for 31 years now, and this has been a very interesting or unusual time that we're going through. Hopefully, though, it looks like it might be coming to an end at some time in the near future. For some of the provinces in Canada, it could be very soon. For others, it might be a little bit longer. But I wanted to talk to you today about a post-pandemic recovery plan. We've been talking a lot about what to do while you're semi-shut down or fully shut down, and things that you can be doing to put your practice in better shape for when you get to reopen one day. But now let's talk about what to do to actually get ready for reopening. There are a bunch of steps that need to be done. The first one really is so obvious. It's like be in touch with your college and your provincial associations to find out what the requirements are going to be, any changes, things that you have to be aware of. Are there going to be rules about physical distancing, about gloves, masks, you name it, sterilization, etc. It's a difficult topic when you don't know what is going to be mandated for you. So all I can say is just be sure to be on top of that and research carefully what it is that you're going to need. The next thing is you need to document all of that into your policy manual so that your staff, when they do come back, are aware of the new requirements, protocols, what's going to be expected of them so that they can comply with all of that as well. Then you want to, review your inventory. I mean, that seems obvious, but there might be some new additions to that inventory that you need to look at. What do you need to order? We don't know whether it's gloves, masks, and all of that, and sterilization supplies and so on. So basically find out what those are and get your inventory up to speed, including making sure that all your usual needed items are in full supply so that you don't have any flaps when you come back, that you don't have some of this or that. It's been a while since everybody's been at the practice full tilt, and so there may have been some things used while you were on emergency treatments and so on. Then the next thing is like clean your practice top to bottom. I mean, go through drawers and empty them out and clean out all the dust bunnies and throw out things you don't need and haven't used for years, and just like really make it as if you were almost brand new in practice and everything was pristine and clean and fully ready to go. That's one thing you can do before you actually open. The next thing is, if you can, have some staff come back, at least the ones who do your scheduling, a few days or a week or two before it's time to reopen. It would be splendid to have them get onto the phones and reschedule everybody into your book now that you know when you are allowed to reopen. So get that book filled up, so to speak. I know it's your computer scheduler, but we still call it the book. And make sure that you have no openings. That would be the game plan, wouldn't it? The next thing is to contact your staff and make sure that all of them are planning on coming back. We do hear on the ground that some of our clients have been told some of their staff don't intend to come back. They're enjoying being off and have decided that they don't actually need to have a full-time job and they don't want to come back. So find out for sure what you've got on board still. If everybody's coming back, then awesome. And if not, then you need to get on to some hiring right away so that you are as fully manned up as you feel you need to be. Now, some practices are not going to come back to full battery right away. In fact, I think some of the regulations are going to be a little bit about that, and you may not be allowed to have a full practice at all times because of social distancing or physical distancing. Are you going to be allowed to have a full waiting room? Are you going to have to make people stand outside instead of waiting inside? Are you going to have to schedule people farther apart so that there's time for the staff to clean up after each patient and before the next one comes into the room? I mean, there's so many variables that we have yet to establish, but as much as you can, have a look at that and see what planning you need to do in terms of number of staff. Now, I don't really have much more to say, except that I'm going to be doing more of these because there are more things that can be done. But today I just thought those would be some things that you could start on fairly soon and keep your ear to the ground and be looking and researching what you need to do. So if you have any questions, be sure and call us. We are doing free consulting until lockdown is over. And we enjoy it a lot. We have, I would say, more than 1,800 clients that we've worked with over the last 31 years. And we love talking to people, and that makes our day busier to answer all your questions. So just give us a call. We're here to help, no charge. And we'll be talking to you again soon about the rest of the things you could be doing to get ready. Okay, bye for now.